So I have a question, and this is something that irks me to no end about the natural childbirth narrative, in that everything is that happens that's an adverse event is considered rare, extremely rare, practically mythical, whatever. Um, what's your reaction? Because you said your midwife, that one midwife said something about, oh, this is a rare thing that happens.
I so I have so many thoughts on this. You're gonna get me on a tangent, but I'm kind of like, first of all, it's not that rare when you lend different perspective to it. If someone hands you like, say it's like 1 in 100 or 1 in 150, but if someone hands you that amount of M&Ms and says one of these is poisonous, is going to kill you, are you going to like pop down those M&Ms? Are you going, like, when you think of that and you put it in different risk, it's way easier to just be like, oh, well, it's likely not going to happen. I don't know. It's not as rare as it seems. Then I also think, and I've actually suggested this, I don't know if we've done it yet, but we've talked about it in the VBAC group, of having a topic tag for paper thin uterus is what I want to call it, because how many times have you seen someone do a birth announcement in like that group, but in general, and someone has said, by the time I got into my C-section, I'm so glad I did a scheduled C-section. When they went in there, they said my uterus was paper thin. They said I likely would have ruptured if I had done a trial of labor on this, and I just happened to elect for a C-section. I think that like part of why this uterine rupture statistic is on the quote unquote lower end of it is because a lot of people still do reasonably pick repeat C-sections and not a trial of labor. And if you had more people having trials of labor, I actually think that you would see it more often when you see how often people are saying, oh my gosh, and my doctor told me when they went in there that I had this paper thin uterus. But really, even if we just use the current statistics, yes, it's, is it happening all the time? No, but I don't think it's as rare as people present it to be. And I do think actually if people did not elect to have repeat C-sections and you were seeing trials of labor, I don't know, it's so hard. Statistics are difficult because of course you would also have more vaginal births for people who decide that they're going to do a trial of labor as well. So I know that's difficult to really come down on, but I will say it's not lost on me that women who say I go in for a repeat C-section and I had a very thin uterus, or my scar looked already like I already had a uterine adhesions, like it was starting to rupture. They are well represented. If you just look even within our group, in the group that we are all in, and you look at people's birth stories, I notice it with somewhat regularity. So I hate it. It does irritate me. And looking back, that's more, it's not that rare. And the thing is, it's one of those things, particularly if you don't take the precautions when it comes to rupture, you don't have a large window of time to work with. It's not a complication that can be managed over a period of time. It's fatal for your baby very quickly, very quickly. And even in the event that your baby does not die, your baby will suffer a brain injury or other things, very quickly, and can have pretty severe outcomes related to that. If not, there's HIE babies who survive, and they survive the hospital discharge, and they go on to die early in childhood too from their traumatic brain injuries that they've sustained. So all this to say, then yeah, because you take even in a TOLAC attempt and things, when they talk about out of those who rupture, this is in a hospital, it's like 6% have a lasting brain injury. Think about that in perspective. That's not to say that I don't think good candidates shouldn't try a trial of labor if they so choose. It's just that I have beef with the minimizing it and the disregarding or trying to, comfort that, oh, it's not. No, be real about what that looks like.
Since we're on this tangent, now that you're in the VBAC group, of course, you know that a rupture can result in a lot of things, none of them good. Mm-hmm. Some of them survivable. When did you learn that a rupture could have cost you your uterus? Did you hear about that from your provider or not until after?
So interesting that you asked that. I knew not to call it my own research, because we all know I hate that phrase. I did my research. I do know from like reading on ruptures a little bit. I remember reading that you could potentially have a hysterectomy and lose your uterus in that. I remember reading it and being like, it probably won't happen though. I will say they were able to repair everything for me. However, I went a full like 48 hours having no idea if I had a uterus anymore or not. I was so preoccupied, and I finally was like, wait, did I have that repaired? It's just one of those things I remember to this day. It was like a full 48 hours where I was like, do I have a uterus anymore? Like, did you fix it? Is it in there? Did you take it out? What happened? I know something happened at this point, but I've been so focused on this baby. I don't even know what I have inside of me anymore, like for parts. It's quite common to have a hysterectomy and lose your uterus. And also I was lucky. I did hemorrhage, and I'd have to go back into my charts. I did receive like a blood transfusion of some sort. I did lose a lot, but I didn't lose as much as some people do. I remember my primary care who was looking at it with me. He's like, I've seen worse, a lot worse. And you know, I didn't actually lose more blood than like somebody who experiences. I mean, I did. I lost a lot of blood, more so than would have just happened in a typical, but not as much, I guess, as I could have. And it could have been worse in that sense. Like for all the things that went really, really bad there, my blood loss was not as significant as it could have been. But I did not know. I really didn't know at all about. So I think like when I learned about rupture, the two things I thought about were my baby could be severely, like my baby could die from a rupture, or I could lose my uterus. I didn't know anything about the other things that fall in between there, where the baby survives but has a brain injury or has, you know, some kind of hypoxic event or has these other things. Even the death, though, my baby could die, or I could use my people, again, my midwives included, were so like, it just never happens. Oh my gosh, it's so small. We have to tell you about it, but it never happens. I just really had thought there's just no way it will happen. It was nothing I was worried about. It was just like, no, this won't happen. Because not only did I see, wow, on this full spectrum of people, it rarely happens. I had then, again, really bought into the idea that I had control that I didn't have. So I was like, I did all these things. So not only is it a small statistic, it's even smaller for me because I did all the things that they told me to do in that Pinterest graphic. So, you know, if the VBAC link tells me it's going to get me a VBAC, then that's probably it, right? They know their stuff. So spoiler alert, they do not. They do not know their stuff.
Yeah, I worked in the children's hospital, and I didn't even work in patient care, and it turns your perspective around because you're like, is there any reason this can't happen to me? And the answer is, most of the time, it's no. There is no reason it can't happen to you. It can't happen to your child. It's just luck. You know, there is no magical nothing that will protect your child. And so as a result, you get weird perspectives also. As you know, I was in the lab and I said something about worrying about birth and what would happen. And they're like, oh, you shouldn't worry about that. We only get to see the worst of the worst, which is true when you're in a level 4 NICU and a pediatric regional center. You see a lot of what gets transferred to you from hospitals that can't handle it. So you do tend to see some really serious cases, but then it has to happen to someone.
Mm-hmm.
So, and that's why I ended up in the hospital with the level 3 NICU run by the Children's Hospital, because I was like, well, you know, better stock the odds in my favor because, yeah, you really don't want that.
I think that's so important what you just said, that shifting of perspective of what, is there any reason this couldn't happen to me, or what makes, because that's one of the things I've talked about, like when you become, it is really just, it changes your perspective. It's changed mine. When I've become a statistic, when I am the statistic, I kind of, one of the things I tell people, like, oh yeah, it might be 1% to 2%, sure, you know, depending on a variety of factors when it comes to rupture at this point, but Yeah, it might be 1% to 2%, sure. But when you're the 1%, it happens to you 100%. Doesn't matter that it only happens, like when it actually happens to you, it happens to you 100%. That's 100% your experience. This is, and I do think I've adopted more of that mindset as a result of that. And I think I could see why you doing the work you were doing, it changes from there's no way this could happen to me, and looking at statistics and looking at things, to being like, well, it happens to somebody makes up that statistic. Is there any reason why that statistic couldn't be me? And that's, it probably sounds cynical, and that's just how I operate through life more now as a result. Like, that's just something lasting. But I don't know, to some degrees, I think it helps me be more present and aware of anything related to health, and it applies to all aspects of your life. And so it certainly, I think it helps me to not, I think that, not to get off and spiral too far, but I think that as society, we do that a lot. We will say, we will look from anything from like drug addiction to suicide to anything, and we will other people and be like, well, it couldn't happen to me. And I think adopting more of that mindset around, is there any reason it couldn't? And people make up that statistic for a reason, helps you to not other people in the name of your own self-preservation, and to have a more really true, tangible, realistic, empathetic view on the world around you. So yeah, I mean, again, I might sound more cynical now than I did 5 years ago, but I don't have I'm okay with it, because I think that it actually helps me better navigate the world we live in.
Well, somebody has to be the statistic. You're the statistic. I'm a statistic. Somebody has to be that number. Somebody has to be part of that study. Somebody's part of the graph. So as much as we see numbers and figures, someone is that. Like, there's people. It's not just one person. There's people that are those numbers. Like, we look at it, 1 in 100. Oh, that's not so bad. Or, it's only whatever. But that's a lot if you really start thinking about how many. Just look around and sit in a doctor's office and look how many people's in the room with you. And you're only there for, as long as it takes you to go back, see her, and leave. You know what I mean? So you really think about 100 people, how many people are they seeing a day? And how many people are having babies? Like 1 out of 100 is a lot. That's a lot happening. Like, to think about that. And I didn't know my statistics. Women are losing babies 1 in 4. 1 in 4 is a lot. So you're like literally looking around at your friends. And if you got 10 friends, that could be 2 of you, but that could be more than that, because the statistic is, as much as in our minds, we use it to whatever, it's still that actually could be more than half of you could be in that thing. So the numbers are the numbers, but at the same time, somebody has to be the numbers. And unfortunately, some of it is us. We are some of those people.
The thing is, when you realize that it can happen to you, that's when you put your seatbelt on. That's when you put your kid in the child seat, make sure it's properly installed, make sure everyone who's caring for your child is doing the same things. And it says, okay, if I could be the statistic, what am I doing to protect myself in that eventuality? And the whole thing about the natural childbirth is they say, well, 1, it won't happen to you. And 2, if anything happens, we'll take care of you. And unfortunately, both of them are lies, because 1, it can't happen to you. And 2, they really have no way of taking care of you. Ruptures are deadly in almost every instance out of hospital.
That's everybody that I know that's had done a home birth at home, or even in a birth center. Everybody lost a baby. I don't know anybody that was, some people might have made it and their baby was hooked up on machines or whatever, but they didn't come back. There was nothing. There's no going back.
Well, I think someone has said before, when people talk about, because frequently when HVAC gets brought up and people downplay rupture risk, they'll say like, well, again, it's the same old, I'm 5 minutes from the hospital. I'm so close to the hospital. I have these providers who are taking care of me and keeping an eye. And first sign of anything going wrong, we'll head in. Well, first of all, we know this is problematic because while I showed symptoms, many people don't, that really you're going to detect those fetal tracings only with continuous fetal monitoring. Intermittent monitoring is not going to tell you that there's a problem. And Third, can you hold your breath underwater for that long? How long can you hold your breath underwater? How long can you just sit there holding? You can't. The time is so urgent. It's so urgent. That's why they didn't stop to pick up the pen. That's why there is no time. The baby is not doing okay. The baby is deprived from oxygen in that scenario. So there is no time. There is no time. Do you want to hold your breath the whole way to the hospital for that 5-minute drive? There's no time. And then that's the whole point, as like, I already was essentially ready to just go into surgery. But when you just come in through the hospital doors, they have to assess what's going on with you and they're going to get you in as fast as possible, but not in the time frame that's going to allow your baby to live. And that's why those stories all have the same outcome. There are certain complications that may or may not have different outcomes, but that's not one of them. That's one that is pretty universally going to end up with your baby dying, and you very likely you're going to be in rougher shape. You'll likely survive it. You might not, but you'll likely survive it, but you're probably going to end up in a more serious version of it for the mother, where you might land a hysterectomy or things like that. And so now you've lost your baby and you've lost your ability to have more children. But it's a difficult truth. And then saying those things, just saying those well, Megan, you're fear mongering. No, that is truth. And we need to be able to not conflate those two things. That telling the truth and being honest about risk and talking about these outcomes is not fear mongering, and the two are not the same.
Truth is not fear mongering. It's just the truth. Mm-hmm. Sharing a story is not fear mongering. It's somebody's story, and we need to hear it. And if it bursts somebody's bubble or it rains on their parade or whatever you want to say, and it upsets somebody, there's a reason it upsets you, because there's other people that hear it and it helps them like figure out what they want to do. And then there's other people that they don't want to hear it because they want to live in that bubble, which is fine, but don't take away from other people that might want to hear it and might want to learn about it and figure out for their own choices. So same thing. I'm a fear monger too. So we're in this together. We all are.
One thing I will say as a positive, to spin some positive on it, for those people, yes, I've had dozens of essentially internet strangers come at me about fear mongering and things like that. However, I've actually had several friends. I had a friend who had a successful VBAC after, and she was like, Megan, thank you so much for being open about your story, because it made me talk to my provider about an end date and what our plan was. And I knew what I was comfortable with and what I wasn't. It made me have more, it prompted me to ask more questions with my doctor. And she did end up going on to have a perfectly healthy, safe VBAC. And I've had people who have said, Megan, thanks for sharing your story. It wasn't a risk I was willing to take after hearing your story. And I decided to have a repeat C-section. And I don't feel bad that some of my friends chose that, because that's a perfectly fine decision. That's the thing, is that my story and stories like mine and stories like yours, Danielle, and any of this, they're omitted from, and then there's still this like, oh yeah, but they had complete like informed consent for what they're choosing and how they're deciding. So I don't feel any sort of guilt that I had a couple of friends who said, I maybe would have tried for a TOLAC, but your story kind of did spook me a little bit, and I decided not to. It just, that risk, watching what you went through, was not worth it to me. I'd rather just have a more controlled environment. There's nothing wrong with that. And I don't feel bad that people, I think that's a reasonable thing. And now, would they maybe have had a successful VBAC? Maybe. Would they maybe have done a trial of labor and had another repeat C-section? Sure. But I think that it's fine for people to, there's plenty of positive VBAC stories out there. It's not like it's just all of us out, just ruining everyone's day. It's fine. You can hear them, but you need to hear both sides of it.
Yeah. I've heard a lot actually like that of some people have made different decisions. And I do tell people, if you choose to have a home birth, that is still your decision. If you choose to birth at a birth center or whatever your thing is, that's still your choice. And which seems to surprise people. But the thing is that I do know some people that have heard, I don't know them, we're not friends or anything, but they have heard my experience, heard what happened. And they were having a home birth. They were already having a home birth before they even heard what happened to me. And then something during labor, maybe they got an off feeling, maybe something didn't feel right, something was happening. And it reminded them like, oh, of what happened to us. And they went in and they ended up, baby did need help. They needed help. And they wrote me and said, thank you, because I would have never been aware of this. And I have had messages like that of the people. And amazingly, yeah, they are home birthers and that's what they, whatever. And they did get whatever, they did get care. I have had the other side of, I was going to have a home birth and then I read your story and, oh no, I decided on hospital and at a doctor. And Good. I've had people come back. Yeah. That they were like, Good. After they've had their baby and after whatever, like, oh, by the way, this happened. Unexpected. I ended up with diabetes, or unexpected. I ended up with a heart problem, or things just happen that is just not expected, that maybe wouldn't have been noticed if they were just being at home with the midwife and whatever. And, and I love all that positive feedback, all that good stuff from people sharing their experiences and, telling me what they've learned from reading someone else's thing, because we become aware of things that we would have never known. And especially if you're a first-time mom or something, you really don't know anything. You don't know anything going on. We've all been there. We're like, I don't have a clue. I'm just following something or nothing. But it is good to hear that there is people that they do listen. So as for all the bad, just if one person had ever wrote me and been like, thank you, you've made a difference. That's all that I wanted. You and your baby and your family is what mattered to me. But to know that I've been out there for all these years and I've been contacted by a lot of people. I've been contacted by medical people and how they've changed the way that they do things with families of trauma and loss. I've changed the way that, that midwives have done their practice of maybe this isn't so safe to go over 41 weeks with people. Like, there's been things that it's changed, it changed the way that we thought. And I'm like, that's good. We're learning, we're all growing together. And that makes me really happy, to be honest, that it's like my story is meaning something. My son means something, that people are listening enough that it somewhere in there triggers something that it's like, oh, I don't want to do that. And I want to do better than that. And that's the whole purpose of me doing all this stuff for all these years of sharing anything about him and all the things that we shared is just for that, just those little moments that it reaches somebody of exactly what they need to hear to make the difference somewhere. They might not need it right that day in that moment, but somewhere along the line, they use it,
Mm-hmm. Absolutely. Makes all the difference. To me, it's the equivalent to sometimes we talk about the reason why in the groups that we're in, like, don't delete your threads and don't do things like that for the lurkers. It's the people who sometimes you might even hear, it's great when we do hear like, oh yeah, your story made a difference, or I decided to do this. But, I always just think too about the silent people who maybe don't say it or who've never commented, but they're taking it in. And I do believe in the end of the day, sharing our stories, despite the backlash we may feel or get, is worth it because it is helping people.
Had people private message me and say, I look at Gavin's page, but I never comment and I can't like on there because they're part of the other side. And if they did any of that, they would be identified with them. And I understand that because I'm not in that world. They threw me out a long time ago, but I do understand when somebody's reading something and to get those messages. And I'm just like, well, if you need anything, we're here. We understand. So yes, people are watching. People do see. They may not say anything, but they're there, and that's okay. That's fine.